Hi, good morning. This is Dr. Khanna, and today I'm going to discuss a very important topic. There's a lot of confusion about this subject. We're going to discuss advantages and disadvantages of making a LASIK flap and which flap is safer. We get a lot of questions. Is LASIK flap safer if it is made by laser versus an automated microkeratome? It has become such a raging marketing piece that people promote laser flaps without really documenting or telling the patient whether the outcome is better or not. So in the first part, we're going to discuss what is the LASIK flap and how can they be made and which one is safer, and we'll touch also on SMILE eye surgery. In the second part, we will go how to improve the outcomes based on the type of laser used to actually reshape the cornea. So we'll go a little bit into the structure of the cornea. This is the top layer called epithelium, and it is around 53 microns thick. Below this area is the stroma, and it's around 480 microns thick. Innermost layer is the decimus and endothelium, and that helps when the flap has to stick back together. They are like the pump of the eye, this layer. When we make a LASIK flap, the flap has to be made in the stroma. So we are cutting the cornea. Now this flap can be made by automated microkeratome or by a femtosecond laser like Intralase. Either way, however you make the flap, you're cutting the corneal nerves, and since you're cutting the cornea, you're taking away from the tensile strength of the cornea. So there is no difference in terms of safety how you make the flap. In SMILE, you go a little deeper and you make two cuts and you remove this tissue. The theory being that the back part of the cornea has less tensile strength, so if you remove tissue from there, it'll be safer. But the jury is still out there to prove that. But what if we didn't want to make a flap to preserve the safety of the cornea? There is a method for that. It's called epi-LASIK or super LASIK surgery. Super LASIK standing for superficial LASIK. In that, we have an automated machine called epikeratome, which mechanically pushes or cleaves the epithelium from the layer here between the junction of epithelium and stroma, and that layer is called Bowman's membrane. Excuse my writing, Bowman's membrane. So in this procedure, where we are using the epikeratome and called super LASIK, there is no cut. So it's a no-cut procedure. So this procedure is safer than LASIK when you have a compromised cornea, like with an abnormal shape or very thin cornea. So this one is safer than traditional LASIK using an automated microkeratome, because this one spares the nerves and does not make the cornea lose its tensile strength. So super LASIK is even safer than SMILE, LASIK by microkeratome, or LASIK which is called all laser LASIK, where the flap is made by LASIK. So in a concluding part today, we have come to the conclusion, after looking at the structure and how each one works, that super LASIK is the safest and even safer than all laser LASIK. Stay tuned. In the next part, we are going to discuss how the outcomes are affected by the type of laser used, and we're going to compare eye design with wavefront, with topography guided, with SMILE. Thank you. Stay tuned and have a wonderful day.